Hi, Dr. William Starsiak here at Starsiak Aesthetics, and if you watch my channel, you know that I'm into demonstrating the new technologies we get on myself. This new one here is the Fotona Dynamis. It's very dynamic, that's why I call it the Dynamis. This is a dual wavelength laser. This wavelength I'm going to demonstrate first is an erbium YAG. It can be used for all sorts of things like resurfacing the skin, removing benign lesions, treating scarring, whether it be surgical, traumatic, or acne scarring. It can even be used for tightening tissue. So when we resurface, we tighten tissue, but this has a mode that spreads out the energy delivery, so it's more of a thermal treatment rather than an actually ablative treatment that's killing cells. Instead, it's heating them up and causing tightening, and we can use it for all sorts of stuff. We can use that inside of the mouth to cause tightening. We can use it around the lips to help avert the lips. What I'm going to demonstrate on myself is on my eyes. So one reason I demonstrate this is because people always wonder, are these technologies safe? And so I love showing that, I'll use this on myself, I'll use this on my mother, I'll use this on my wife. These technologies are safe. Now, generally, if we were treating a patient, we would have protective stuff over their eyes. But I know what I'm doing. I'm going to be very careful. So I'm going to you're going to see as I treat myself with tightening the eyes. So if you have this sort of lid lagging that can happen to some people, I'm doing pretty well. So I'm really just demonstrating. I don't have too much of it. But it's a common concern amongst people. What we do is we take this mode and we go. This is pulsing heat. So there's like 5 spots, and I do just 3 pulses in each spot. And I haven't numbed. I'm doing this entirely without any numbing. We do numb topically for people, just because there's a little bit of heat. Be a little bit of redness compared to the other side, but nothing severe. So we can get the underside now. So when we do a 4D, we can use that in different areas. The typical 4D is actually inside the mouth. So we tighten through this region to help getting more of a sort of narrowness through here, because we're getting both tightening from the inside and the outside. A different capability that this laser has, and for those who know about lasers, that this is an ND YAG. So it's a different frequency. This frequency, this wavelength of light actually resonates with oxygenated, deoxygenated blood and pigment pretty strongly. So this method will actually hit different layers. So if there's little bits of vascular irregularities or there's bits of pigment irregularities, it will cause localized damage in those layers, which leads to tightening, but it also leads to evening of skin tone. So this one's pretty cool. Now this is one though that we cannot use over facial hair if someone doesn't want to lose that hair. So it's actually a bonus for people who have, say, women who have a little bit of hair on their upper lip or on their chin. But when we do the 4D, this is the second step. I can already feel noticeable tightening, and so you can see there is there's a shininess as well. Now we can move on to the third phase, piano mode, and this is a thermal heating, a deeper thermal heating. It's just going to tighten collagen. So like a lot of people want to lift through here. So this is one we definitely use in through the cheek region. A lot of people want to get tightening through here. So we can use this through the neck. We can use this through the jawline. So it just feels like warmth. And it's actually soothing, you know? Now you can see that, just that rosiness, that effect that's occurred, and right, it's not the same as over there now. The frac 3, that is beginning to calm down, so it's not quite as red. Let's see, we'll just do the same thing on this side. There you go. So that's step 3. And now let's do step 4. See that? So I have a little white dot. Right? So I can do this all over my face. And this won't hurt the hair. And actually doesn't hurt me at all. Now this is a pretty light peel. We can go a lot deeper with this. And the reason you're seeing that smoke is being released is because it is ablating these cells. And what it's going to do is, as you get rid of the upper layers, it's going to stimulate it to regrow. And so the skin is going to look younger, fresher. There's going to be a better glow, and any scarring that was present is going to be decreased. Collagen's formed, so it starts to tighten. So you just get a more youthful, clear-skinned appearance. The pores are smaller. And with a light peel like this, I mean, you get a little bit mild flaking that will persist for, 5 to 7 days. And it's easy enough to accommodate, because then just in the shower after you wash your face, if you just kind of rub your face, you can get the flaking off so you don't see it during the day. But by a week, that's completely stopped. And that's it. That's an example of what one Fotona 4D could look like. Instead of going inside the mouth, we can go over the eyes. We can also use that smooth mode to help regrow hair. So for that, this is just heat-based. We can go into the hairline and so this stimulates the arteries. There you go. It's as simple as that. We would do more than for a full treatment. But so there you can see, immediately the face doesn't look bad. I'm not going to expect any sort of scabbing from this. I'll just have a little bit of flaking over, the next 5 days. And after 2 days, I can use some alpha hydroxy acid to help clear that flaking off faster. But this will heal really quick. I'll actually go and get some aloe vera. We have a plant in the office that we use for these procedures. Aloe vera is a fantastic plant to have for when you're doing skin resurfacing. It is anti-inflammatory, so we want inflammation, we just don't want it to be out of control. So it'll modulate the degree of inflammation. And then it's soothing for when you resurface, it feels like a little bit of a sunburn. But for something like this, I'll just apply the aloe, and then I'll apply the regenerative skin nectar once the aloe dries. I want to show you what it looks like about 24 hours out. In the areas where I missed, you can see the difference. So it's very mild. Thank you very much for taking the time to watch the video. I hope you found it informative. If you have any questions, put them in the comments.